and welcome to Your Wealth Health. I'm Erik Brenner, President and CEO of Hilltop Wealth Solutions, and I'm glad that you joined me today. And I have with me today Matt Aurenz, a private wealth advisor with the firm. Matt, thanks for joining us.
Yeah, thanks for having me.
Before I jump into our topic today, I just want to thank everybody that viewed our show last month. We had overwhelming success and requests, and we thank you for that. There was a lot of energy around finding out about Social Security and the strategies for you. And today is a very important topic, Medicare. So let's kind of dive into Medicare. You know, when you think about it, people are living longer. In fact, Social Security says that if there's a couple today, age 65, there's a 75% chance that one of them will live to 85 or longer. So it's really a very, very big decision for people.
It's a huge decision, and it's one of those that you're making a big decision on, is it time to retire? When should I retire? And as you're going into that next phase of life, you're smacked with another huge decision, which is, how do I handle my medical insurance the rest of my life?
Yeah. So I'd like to start off by taking a look at the screen, this flow chart that we've put together on what do you do when you turn age 65. And if you see that the left-hand side says if you're covered by an employer that employs 20 or more people, it takes you down a path to determine whether or not it's a good plan, whether or not you need to enroll in any sort of the options with Medicare, and kind of helps you think through it. Whereas if you are 65 and you're not employed, or you have an employer that has less than 20 employees, then you've got to roll in Medicare and go through the initial enrollment period. So it's really important to make sure that, first off, you enroll when you're supposed to enroll. Right? And then, there's always a lot of confusion on, what is Medicare? What's it encompass?
Sure. So Medicare, there's really four components to Medicare. So if we take a look at the slide here, the first part being Part A, which is hospital insurance. So if you have an emergency, you end up in the hospital, that portion of Medicare will pay. The second part is Part B, which handles your regular medical insurance. And that's the component that really is just your day-to-day doctor visits. But again, Medicare is only going to cover 80% of that. The remaining 20% is what you're required to pay out of pocket. You also have Medicare Advantage plans, which are known as Part C. And the Medicare Advantage plan is going to be your Part A, your Part B, and your Part D all wrapped up into one plan. And then you have Part D, which is just the Medicare prescription plan. So those four components are what make up your Medicare.
Yeah, and so I think that it's important as folks are thinking about it, or even if they're in a Medicare program right now, there's kind of three paths to take.
Correct. And you really, when you're taking a look at three paths, the biggest option that you have here, if we take a look at the next slide, there's really just option one, option two. So the three paths kind of fall in line with this, but your original Medicare, if you will, is Part A, it's Part B, and then you as the consumer have the option to choose your prescription drug plan, which is Part D. And then you would fall in line with a Medigap policy, and your Medigap policy is really just going to be your co-insurer, if you will. Your traditional type of insurance that most people are used to when they were employed. If you take a look at a Medicare Advantage plan, the biggest misconception is that these are the same, and it's not. A Medicare Advantage plan is going to be, it's your Part A, your Part B, and your Part D, all wrapped up into one, but you're not. You don't have a Medigap insurance policy on there as well.
Yeah, and I think you're right, Matt. We hear this a lot from clients that there's a lot of confusion, and they really did not or don't know that it's separate.
Correct.
Right? And the other thing that we'll talk about a little bit more later on in the show is, oftentimes it's thought that the pricing or cost of the options are the same.
Right. Yeah, and they're not. The ability to be insured is the same. So regardless of the carrier, you can get insured. However, the pricing is going to be different. What for example, the prescription drug plans, what they cover, what they don't cover, those are going to be all different. So you really have to take the time to focus in on If I have prescription plans, which ones are covered by my prescription drug plan and which ones aren't, and what do those costs look like, and really have to start going down that path of which prescription drug plan is best for me.
Yeah, those are some great points. In addition to Medicare, I think, and Medicare Advantage plans and what to choose, there's a lot of confusion around, what if I'm continuing to work and so forth, and I'm over 65, and we see a lot more people now working, or at least working part-time over the age of 65, and I know we'll talk a little bit more in another segment about it, but it really comes into play even more so because of the cost. And so, one of the things that we've seen is the cost of these Medigap policies and Medicare Advantages. Those costs continue to go up, they way outpace the inflationary increases that Social Security has.
Right.
And the other thing I think about is oftentimes people think Social Security and Medicare are tied together.
Right, which they're not.
They're
two different components.
So they got to think about those two different strategies and how to go about it.
Right.
So
planning for a retirement income stream is much different than planning for health care needs.
Yes.
They're two different components.
Yeah, and so we hear this all the time with clients. Their mailbox gets filled up. So they get close to that age 65. Their mailbox gets filled up with all kinds of material on what plans there are, sign up with us, and so forth. And how do we think about that?
That's a great question. I think the biggest thing is to plan ahead. And don't make this decision the day you turn 65. It's something that you need to prepare for. So as you're getting into 63, 64, start educating yourself, start talking with your advisor. We work with some healthcare specialists that really educate clients on what's the best way to plan for their healthcare needs at the right price, the costs based on their health standards. So you really just have to plan ahead. It's not something that you can just walk into and plan for later.
Yeah, and now now's the time. It's open enrollment, so if somebody has a current plan, it's time to review what you have, and if you're going to be new to it, it's time to kind of think through the options and what's best.
Exactly.
Right? And they change. The other thing is that oftentimes someone thinks, well, I got a plan, I don't need to make adjustments, but they really need to take a look at it and review it.
Correct. Yeah, your health is going to change just like the costs are going to change.
Yeah, exactly. Well, thanks, Matt.
Welcome.
When we return to Your Wealth Health, Don Griffey, an independent healthcare insurance consultant, will join me, and we'll talk more about Medicare, the Medicare plans that are available, and take your questions.
Riverbend Cancer Services serves our cancer survivors and their families in three very distinct ways. The first is financial assistance. For those people who are having a tough financial time through their diagnosis, we step up and help them pay for their medications, their transportation, and other needs that come along so that they can actually focus on getting better. The second thing we do is we offer wellness programming. This is an opportunity for our cancer survivors and their families to reattach a positive image between their physical selves and their minds, really paying attention to that mind-body connection. And the third way that we help people is through counseling services. That's everything from the one-on-one individual counseling to support groups, to art counseling, to music counseling. We do all of this free of charge, and we also do all of it to equip people with the tools that they need to reduce the fear and the anxiety that comes with the diagnosis so that they can live their most hopeful and healthy lives. To learn more, visit us at riverbendcancerservices.org.
Welcome back to Your Wealth Health. I'm happy to have Don Griffey join me. Don is president of Hailey-Campbell Benefits. Don also serves as the state past president for the Indiana State Association of Health Underwriters. And over the past 8 years, Don has spent much of his time working on healthcare reform. And with the passage of the Patient Protection and Affordable Care Act, Don has been teaching courses for insurance agents, accountants, doctors, and on the components and impact of the healthcare reform. Don's a noted expert and speaks throughout the area and to the general public on health insurance and helping educate people in understanding what they have. Don, thanks for joining me.
Thanks for inviting me.
Yeah, you're welcome. So Don, you've been in the industry for many years. So let's start off by talking about, I see a lot of confusion when someone retires prior to age 65, right? What do they need to do?
Well, if they're going to retire before age 65, they've got a couple options. Their company may offer them COBRA. It may not offer them COBRA. There's also the healthcare exchanges that are available for them, which that is another different market segment, but it is available to get them to age 65 where they are eligible for Medicare.
So there's nothing from a Medicare perspective that they do?
No. They can apply for their Medicare benefits up to 3 months in advance of their 65th birthday, and it becomes effective the first of the month of their 65th birthday.
Okay, so you recommend that 3 months prior, then if they are in fact planning on retiring, right?
Yes.
And need Medicare, assume need Medicare, that process starts how far in advance from your 65th birthday?
If it's, I would say 6 months.
Okay.
Because they are going to be making a decision. In the past, if they work for an employer, the employer decided what the medical plan would be, how it was designed, what it would cost. And their only decision they needed to make was, did they want to be on the plan or not? Now they're required to make that sole decision all by themselves. So to know what you're going to do in the future, I think instead of waiting until, as Matthew said, to your 65 that day, I believe you should sit down with a well-educated and well-versed individual, find out what Medicare is and what the various paths that are available to you before you even sign up for your Medicare benefits.
Okay, that's great advice. So 6 months to really start sitting down and thinking about it.
That's correct.
Right, that's great. So, we talked a little bit in the first segment, the difference between Medigap and the Medicare Advantage. So maybe you can help just kind of expand on that a little bit.
Right. There are three distinct paths that an individual can take once they're Medicare eligible. The first path that is very seldom ever used is there is no requirement, or is it mandatory, that you have any coverage other than Parts A and B. However, Medicare Part B only covers about 80% of your medical expenses, so that person would be responsible for the remaining 20%, and that's based on an unlimited amount of money. And Medicare, from its founding to today, does not include items such as dental, vision, hearing, and the big item is prescription medications. So without covering prescription drugs, you would be responsible for the whole cost of those medications.
Which can get very costly.
It can get very costly. That path is very seldom traveled down for obvious reasons. The other two paths is having a and B, which you'll always have, and having a Medigap policy. A Medigap policy will help close that 20% hole that Part B does not cover for Medicare. With that type of plan, you would want prescription drug coverage, so you would need to purchase that to close that unlimited amount also. There is another product. It's called by various names. It's called Medicare Advantage. Some refer to it as Part C. Some refer to it as a replacement plan. It's all the same thing. And how that differs is you still receive all the Medicare benefits that you're entitled to. You just get them a different way. Instead of Medicare being the payer, the insurance company that you choose the Medicare Advantage plan becomes the payer instead of original Medicare.
So do you think there's one better way than another, or does it really depend on the individual and kind of what they're comfortable with, what their health history is? How does that?
No, there is no one path that is correct for everyone.
Okay.
Again, very few travel the first path that I mentioned. Approximately 30% of the people in the country today have a Medicare Advantage plan, and approximately 70% have a Medigap plan that they have.
Okay. So very important when folks are thinking about this, whether they're currently on Medicare, right, with a Medigap plan or Medicare Advantage, or getting ready to enroll, understanding that it really comes down to their specific need
That's
and
correct.
situation. So I know we wanted to talk about just some real highlights, just a couple quick things. So on the show, I really like to point out, here's a couple keys. And so if they take a look at the screen, Don, you might want to comment on kind of a couple of these keys for folks to think about.
On a Medigap policy, there's various Medigap policies that you're allowed to choose from. They vary in benefits slightly. So knowing what those standardized plans look like, you'll want to pay close attention, and you'll want to make sure that you get them from a reputable company. There are some that are more reputable than others.
So that includes really, the name of the company, but, a reputable company. Are they good paying their bills and all of that, right?
That's correct.
Yeah.
Yeah, the only thing that separates one insurance company on a Medigap policy from another is the price that they charge and the service that they give.
And I think that's really important because I mentioned it before, but, there's so much confusion that it's standardized, and that it is standardized,
That is correct.
right? But not pricing.
Correct. It is standardized for the benefit.
Okay. Yeah.
And then the drug plans, the Part D, as we call them, they vary greatly. And I have some that in the past that have asked about prescription medications. Is it necessary to have these? Or are all my drugs going to be covered? There's various questions that come with this that I think we'll get into later on in the show. But the prescription drug plans, there are going to be dozens, literally dozens of plans available, and they will be geared what you choose based on your specific circumstance with the medications you take, the dosages, the frequency, and how you want those drugs filled, whether retail or mail order.
So you're saying that's even more difficult. That's just with all the different prescriptions and so forth.
The Medigap policies that take care of the health are pretty cut and dry.
Okay.
The Part D plans for prescription drugs, that is really a wild card and
Okay.
can be from one end of the spectrum to the other.
Okay, great. Don, thank you very much. When we return on Your Wealth Health, Matt will rejoin us here, and Matt, Don, and I will take your questions, and then we'll summarize some really key follow-ups for you as we are now in the enrollment period for Medicare.
Are you running a business? Not happy with the sales? Don't worry. TJ21 Media Group is a full-service video production company. So why TJ21? We offer the best in high-definition video production with a passion for everything we do. We provide a wide range of services from TV commercials to aerial shots to local events. Let us help you market a new stimulated concept that makes your customers want to do business with you. Call us at 574-607-8112 or visit tj21.com.
Welcome back to Your Wealth Health. And Don and Matt have both joined me, so why don't we take some questions?
Sure.
Sounds good. All right, so our first question is Mary from Indianapolis, and she is currently 64, getting ready to sign up for her supplements, and I'm healthy and take no meds. Am I required to take Part D?
Okay, the short answer is no, you're not required to take Part B or Part D. However, keep in mind that open enrollment ends on December 7th. And even though you may not be taking medications on December 7th, your doctor on December 8th could prescribe you a medication that costs hundreds or thousands or tens of thousands of dollars, and you would not be able to get a prescription drug plan to the next open enrollment for the upcoming year. So the real risk is not having prescription drug coverage, and I always recommend and always have firmly believed that investing $150 in a drug card that you may not use at the current time gives you the peace of mind of knowing what the future holds for you and having coverage if you do need it.
Yeah. So once you can you get Part D if you don't take it for a year or two? Can you get into Part D after age 65, or is there some prerequisite or?
Yes, if you don't have what they deem to be credible coverage when it's first available to you, and then at some point in the future you want to get a prescription drug card, there will be a penalty assessed to you, 10% for every month that you didn't have credible coverage with Part D that you could have had it.
Yeah.
So each month, that fine that's levied on the individual will last the lifetime of the person.
Yeah, Matt, we really don't like clients paying fines.
No, that's a costly decision.
Yeah.
Very
so
costly.
so yeah, that's a big one. So hopefully, Mary, that helps answer your question there. Now, Albert from South Bend said that he has a Medigap F policy.
Mm-hmm.
And heard that Plan S will no longer be available in January. I think Matt and I actually have run across this already a couple times where people are asking because I think they're getting kind of review letters. This is enrollment period, right? So they're getting review letters from their providers. So he wants to know, will it be available in January?
Well, let's go back to where this started. This all started with the passage of the Affordable Care Act. When it was signed into law on March 23rd of 2010, it eliminated first dollar benefits. So if a person is eligible for Medicare before January 1st of 2020, they will have an F policy available to them. If they have an F policy today, they will be able to continue that F policy for as long as they want to continue it. Newly eligible Medicare beneficiaries beginning January 1st of 2020 will not have the option of Plan F or Plan C in the Medigap policies. And consider all the options that are available out there as long as is with your health. But if you want that plan, they're not going to take it away from you.
Yeah, that's really important. So another question we have is travel. So a lot of people that Matt and I work with day to day are doing a lot of traveling, not only just in the U.S. but internationally. Mm-hmm. And that's part of what we want them to do. We want them to travel, right? But what about coverage internationally? How does that work with the whole Medicare program?
Well, it's not just the Medicare program, it's all private insurance as well, regardless of age. Once you leave the United States, other countries have socialized medicine. Unlike the U.S., they are not required to treat individuals in socialized medicine. They will treat you, however, many and most times they're going to require you to pay upfront before you receive the care that you need. This is where the nightmarish stories of maxing credit cards, having money wired over. So there are holes. There is some coverage with Medicare up to $50,000, but that $50,000, to give you an idea of how far it will last, an air ambulance alone to get you back from England to the U.S. is going to run you $75,000. So the $50,000 that Medicare has as a maximum wouldn't even cover that.
Okay.
When a person, either online by themselves or through a travel agency, many of them have travel insurance that's offered. Most, if not all of that, is a reimbursement. So you still are in the position of having to pay up front, and then once you get back to this country, then trying to get your money back from the insurance company.
Yeah, and hopefully you can get the money.
And hopefully you can.
Because you're overseas somewhere traveling, right?
Right.
So makes a big difference.
And there is at least one product out there that I and others do represent where it is a policy that you buy for the period of time that you're gone. It has a $0 deductible, $1 million benefit. They pay the providers directly in that country. It has no excluded countries. And then you can decide at that point, do you want to be treated in that country? Do you want to come back to the U.S. for your treatment? So I would be very, very careful about purchasing travel insurance, and like many things, be sure that you read the small print. If it is insurance, how that insurance is going to work.
Okay, yeah, that's some great points. Thank you, Don. Thank you, Matt, for joining me today. Some great information and a very important topic.
Thank you.
So I'd like to thank all of you for joining us. If you want to have a little bit more information, I'm going to encourage you to go to our website, yourwealthhealth.com, and you can get a free Medicare planning guide. That'll give you a lot more information. You know, Hilltop Wealth Solutions is a registered investment advisory firm, and that means we are a fiduciary. We must always act in the best interest of our clients, and we don't sell products nor solutions. So if you are in need of maybe some advice, whether you have a relationship and are looking for a second opinion, or if you don't have a financial advisor relationship, we're always open to taking a call to find out more about you and to see if there's a fit. I'm really looking forward to our next show, which will be on cybersecurity and identity theft. And I'm going to have a special guest, Robert Siciliano. He's world-renowned expert when it comes to cybersecurity and identity theft, and he's appeared on multiple national publications and news media, has written 5 books, including an Amazon bestseller, and has a lot of insight when it comes to protecting your identity. So I'm going to leave you with a quote, and that quote is, "It's better to look ahead and prepare than to look back and regret." Jackie Joyner Kersey. Thank you for joining us, and we'll see you next time. Thanks, guys. Thanks for having me. Good job.